Does venlafaxine affect the heart? Have you ever wondered how certain medications can impact your heart health? Today, we are focusing on venlafaxine, a medication often prescribed for depression and anxiety. It is essential to understand how this drug can affect your cardiovascular system, especially when coping with withdrawal or managing substance use. Venlafaxine is classified as a serotonin-norepinephrine reuptake inhibitor. This means it works by affecting the levels of serotonin and norepinephrine in the brain. However, these neurotransmitters also play a role in how your heart functions. One of the notable effects of venlafaxine is that it can lead to an increased heart rate, known as tachycardia, and elevated blood pressure. These cardiovascular changes are important to monitor, particularly for individuals with existing heart conditions. Research indicates that people using venlafaxine may have a higher risk of heart rhythm disturbances. In fact, studies show that the risk of dangerous heart rhythm problems is about 34% greater for venlafaxine users compared to those on other antidepressants. This is a significant concern, as these arrhythmias can be life-threatening. Additionally, there is evidence suggesting that venlafaxine may increase the risk of heart attack and stroke. Some studies report a 36% increased risk associated with this medication, particularly at higher doses. The higher the dose, the greater the potential for cardiovascular complications. Another important aspect to consider is the QT interval, which is a measurement on an electrocardiogram. Venlafaxine overdose can lead to prolongation of the QT interval, indicating a risk for serious arrhythmias. In overdose situations, venlafaxine can stimulate the sympathetic nervous system, causing further increases in heart rate and blood pressure. Due to these risks, it is crucial for individuals with pre-existing heart disease or uncontrolled hypertension to use venlafaxine with caution. Medical guidelines suggest that doses of 300 milligrams or more should only be started under the supervision of a specialist. From the perspective of coping with withdrawal, these cardiovascular effects are particularly relevant. Individuals misusing or overdosing on venlafaxine may experience severe heart complications, which can lead to fatal outcomes. Therefore, managing withdrawal and detoxification processes must take these heart-related risks into account. In summary, venlafaxine does affect the heart by increasing the risks of arrhythmias, heart attack, and stroke. It is vital to approach the use of this medication with care, especially for those vulnerable to substance abuse and addiction. Always consult a healthcare professional for guidance on managing venlafaxine use and withdrawal safely.